day, it's Dr. Rapiti, and it's another one of my videos after a long time, and I'm pleased to say I'm not seeing any COVID. Be that as it may, there is some patients presenting with the flu. I don't know what this fourth wave is about, but they sound more like a type A influenza type of infection, not quite COVID. But what I'm now seeing is, on a regular basis, a number of people presenting with adverse events of the vaccine, and they rather bizarre, and it cannot be explained, but I think I would like to give my own explanation to it. This young lady presented to me complaining that after she had the second vaccine, which was it? It was the Pfizer vaccine, and after that she didn't feel good, she didn't feel assault, that's what they tell you. She felt weak, she had this gastroesophageal reflux, and she had this heaviness in the chest, and the legs felt a bit lame. And what was also very striking is that she suddenly, for the first time, developed high blood pressure, and her chest was a bit tight, and she had postnasal drip, which she never had before the vaccine. But yet to tell you her problem, and she also had, incidentally, panic attack or heart palpitations. This is something I'm finding as an adverse effect, that many people who take the vaccine end up with severe anxiety and panic attacks. But yet to tell you a little bit of a story as a patient herself. So how did you feel after you had your second vaccine, ma'am?
All my muscles was aching, and I had a lot of pain. And that was more than a week that I was going through it, and then I started to get this heaviness in the chest and this reflux, which doctor said it's a cause of the heart failure. But I couldn't understand why that was there, because it was never there. And my blood spiked, high blood, which I never had. It was always low.
And you had the ringing sensation in your ears?
Yes, the ringing sensation in my ears every day, which that is not.
And you have this funny sensation in your legs as well?
My legs, I have, it's like a nerve that pulls all the time, and keeps you out of sleep.
Yeah. Well, this is quite a common symptom, a neurological symptom. What I would think is happening here is the spike protein is going on towards the nerves and attaching, and maybe there's an inflammatory process going on there and giving that sensation. It's as if you're triggering that nerve all the time. That is why she's going through this. But she also had reactions to prednisone, which is very unusual. She's an asthmatic now. I picked it up that she's got quite severe asthma. So the approach to treatment here is going to be ivermectin. My reason for that is that it does have some anti-inflammatory properties, because what else do we have when somebody is reacting to prednisone? So there is a place for it in treating post-vaccine events or adverse events. But we will see how she responds to that. And thank you very much for watching.